A weekend normally associated with Boston's Caribbean Carnival was recently marked by a flagrant violation of the urgent call for social distancing. Instead of carnival, the event was a two-day street festival in Dorchester with thousands of people. That resulted in outcry from community leaders in the Black Boston COVID-19 Coalition and efforts to keep similar events from happening later. Joining us is one of the coalition's members, former state senator Dianne Wilkerson. Thank you very much for being with us, Senator.
Good. Thank you. Thank you. Good to see you.
Senator, it took me, good to see you again too, Senator. Thinking about this gathering of people, when I remembered that it was Carnival weekend, I said, oh, of course, people must have known this was coming. Were you one of the people who foresaw this?
Well, I was, only because I was told it was. And I think, in fairness, just to set the stage, we knew from months ago when the city officially canceled all our festivities, like no festivals, no carnival, no kite festivals, no Caribbean festival, Puerto Rican festival, Dominican festival, all the things that make Boston summer. We knew they weren't going to happen. And so I have been involved with the Caribbean Carnival Association for almost 20 years now. I'm a board member. And so one of the things that we were hearing were that there were just going to be people who would decide to do their own thing anyway. And so the Caribbean Carnival Association actually approached the city and state and met with the police department and notified City Hall, met, with the mayor's office to let them know that they were concerned, in part because they didn't want to have any assumption that they were at all involved with this, that they were not, that they wanted to be responsible. They're very concerned, as we all the responsible adults should be. And I think that one of the things that came out of last weekend, or what we learned, Chris, and I was not aware, is that apparently what was happening in large measure and large scale has been happening for the last several weeks. And so there was a weekly series of parties and picnics and outings, both in Franklin Park, that's oversaw by the state police, Talbot Avenue. There's a large Latino coalition and groups of people have been meeting. There's a large Caribbean, there's a large Black. So I don't want anybody to think that our issue was the Caribbean celebration any different than all. Our focus is safety. Our goal was never. So the Boston Black COVID-19 Coalition came together in April. I know you've had our colleague Louis Alisa on to talk about it. Our goal was just to make sure that if Black and Latino folk were going to be the highest hit by it, and we were speculating at the time, and of course it turned out we were dead on, right? That we got the appropriate healthcare resources, the medical resources, the testing, the monitoring, the tracking, the tracing, the information, the resources, wherever it is. We don't have sicking the police on people as part of our agenda. So I want to make that clear, that the concern and horror that we felt when we were watching the live videos, live streaming last Saturday night, were concerned about what the potential risk for this spread. And why? Because Black and Latino communities have a different kind of potential harm that, Cohasset and Chatham, the two events that forced the governor to a press conference, right? But ours is a different kind of concern. And that is that the fact is the overwhelming representation and majority of people that we call essential service workers are Black and Latino. Those are the folks that are in the grocery store. They're the folks that are riding the bus. They're the attendants at Brigham and Women's Hospital, at BMC. They're the people that are checking you in. They're the maintenance workers. They are the caretakers for the nursing homes and the healthcare facilities from where more than 50% of the fatalities from COVID-19 came from, which means we have to have an even higher level of concern for their risk of exposure. That was our concern, and we were frantic about it. And so once we saw it happen, we saw the police literally standing on both ends of Talbot Avenue. And I think you don't have to be a military person to see and observe what they were doing. It was containment. Let them party. And then when it's over, make sure that the leaving was smooth. And I'm not blaming them. I think once you get 2,000 or 3,000 people, I wouldn't suggest that the police walk in there, the police go in there. That would be crazy. The question is, how did it ever get there? Since they knew there was clear notice. And in fact, like I said, now we know it's happening every week. And it may in fact be the explanation for why our numbers keep spiking. You know, East Boston, overwhelming Latino, the highest numbers. Well, anybody would be foolish not to see there's a connection here. If we allow these things to happen, and I think for the greater population, Chris, what I think that the governor, the mayor, the city councilors, the state electeds, the public health officials get wrong is that if in the back of their mind, there's some sense, oh, they're people of color, let them do what they do. It is suicidal, because those are the folks who got up last Monday morning and went to work and are taking care of all of our buildings. And shame on us for not making and understanding that connection. So still, there's nothing that's happened. We literally have the potential for the biggest super spreader, cluster in New England, if not the country. We do. And for us to be sitting here quiet, nothing's happening. No mobilization for testing, no tracking, no PSAs, nothing. I think is going to be a huge mistake. Huge mistake.
Back when we had the series of protests in late spring, there was some concern about the crowds and the possibility of spreading. The test showed there wasn't much spreading that happened. What's the difference between that and both the level of risk and necessity involved in these other?
I'm glad that you asked. One of the things is that the protesters, the very function of how the marches work, people line up and they all are marching that way. You know what I mean? So everybody's marching. There doesn't mean there's no interaction, because clearly people are talking. What you saw overwhelmingly were people wearing masks. What we saw last weekend overwhelmingly were no masks. There were no masks. Well, I would say for every 100 persons that I saw, Chris, I might have seen 2 masks. There were a lot of people wearing the masks around their necks. Actually, like I said, that doesn't count. That doesn't count. And I think that, I've heard people have raised that. Well, you didn't say anything about the protests. I get that. And I think one of the things that we know for a fact is that the protests have not resulted, and there was concern, they have not turned out to be high risk for transmission. And I think it's because of the way it goes. And I think it's the responsibility of the people who are organizing. If they do nothing else, they tell people you have to have a mask. You got to wear masks. You got to wear masks. We saw none of that. In fact, what I saw was a lot of Coronas being shared, bottles, and people drinking and then passing and somebody drinking. I saw a lot of blunts being shared. Somebody would take a puff, hand it to someone else. That is suicidal. And the thing, people have talked about it in the context of, what I would say is this is not if you want to kill yourself and not wear a motorcycle helmet argument. That's my point. This is every single person that was there puts at risk every single person that was there, every person that's in their household when they went home, every person that they come into contact with on Monday morning when they went to work. It's not an accident that the 3 deaths that are now recorded from that wedding in Maine that we all know so much about are 3 people, not one of them attended the wedding. Not one of the 3 attended the wedding. People, this is real. This is not people, and our rub right now is that there's this perception that we are horrible because we are sicking the police on our community. We think that the police are the last resort. The problem is that the governor and the mayor and I think elected officials have been using the police as the only resort. And that's the mistake for Boston. We got to get it together. There's still no plan.
Carnival committee might be able to control people with a flatbed and those monster speakers during Carnival itself. But if people do that on another date for another agenda, how do you control them? I know there's some kind of organization going on there, but how do you get a handle on that?
So be clear, Chris, more than that. Around 4:00 that Saturday afternoon of the 28th of August, they were all over Facebook inviting people to come to Talbot Avenue. There was a whole delegation that came from Worcester. Now it was the Worcester Carnival Association that was organizing that trip. They were on Facebook. It wasn't even a secret. And in fact, at some point during the night, there was an announcement, and in the flyer that I saw that said, come to Worcester tomorrow and let's do this all over again, because Worcester's carnival always goes the day after Boston's carnival. The problem was that wasn't Boston's carnival. And so the issue for us is that there is absolutely no rational thinking that would have allowed that number of people to amass in the first place. I saw 2 flatbed trucks inching down Talbot Avenue, at 11 o'clock on Saturday night, live, with the music on it, the speakers blaring. I saw smoke. I thought there was a fire. They said, no, they're grilling. There's grills. There were a series of barbecue grills set up. There was a DJ that put his table and speakers on the top of the car in the middle of Talbot Avenue and started playing. But it's too late then. The fact is that the smart thing to do, the wise thing to do, would have been what happened this weekend, finally. And that is, they barricaded the street, said, no, you can't go down there. We don't want our street to look like, a war zone where there's barricades and you can't get in. But I didn't miss the fact that a lot of those residents on that street said thank you, because the week before they were up all night. The kids didn't sleep. The parents didn't sleep at all. Nobody was sleeping. And so it takes, there ought to be a conversation. For some reason, Chris, I cannot figure it out. There has been a flat out refusal. Unwillingness is a kind word. A refusal by the state folks and the city to actually meet with the community to talk about it. They just won't do it. Not even a virtual meeting. We still haven't had one, by the way.
Well,
The only person
maybe some legal action as well. Thank you very much for raising the issue.
We need a plan.
Yes, Dianne Wilkerson from the Black COVID-19.
Thank you so much. Important
Thank
issue,
you for
and you're
sharing your
always
time.
there. Have a
Good
wonderful
to see
day.
you again. You
Bye-bye.
too, Senator. It's Dianne Wilkerson from the Black Boston COVID-19 Coalition.